Hey, it's Chris Lyle. I'm the executive director of the Touring Career Workshop, and today we're coming at you with the first in a series that we're going to do that addresses some physical well-being things. So, we've always been big proponents of mental health, especially with the stresses of our industry. But one of the things that goes overlooked is our physical health, especially with the long hours that our industry works and the physical toll, the things that we put our body through. So, we're going to address some of those topics in a series of video chats that we're going to release over the coming months. And joining us today to kick these off is Dr. Kevin Bradshaw, who's a chiropractor. Kevin, welcome,
Hey.
and thank you for joining us.
Hey, I appreciate it.
Yeah, tell us a little bit about yourself and where you're located and all that good stuff.
Absolutely. So my name's Dr. Kevin Bradshaw. Been in practice for about 7 years so far, and we own a clinic in Old Hickory, which is just a little bit east of Nashville, just by about 15-20 minutes. But yeah, we serve a lot of the touring industry, a lot of lighting technicians, a lot of speaker techs, anybody on the on the stage crew. A lot of those guys and women are coming into the clinic.
That's awesome. That's awesome. So you got a lot of our peers as clients. I love that. So,
Oh yeah.
Kevin, I don't know a lot about the physical body. I know limited things, but what I do know is that the back and spine are very important to our overall physical health. Can you just talk to us about how important they are?
Absolutely. So I always think the best thing to talk about, and I do this with all our patients too, is trying to make that connection with what physical health with the spine and body, and how that spine and nervous system really interacts with the musculature and every other organ. So when we get down to the basis of it, you have your brain, and then your brain, you have your spinal cord, and out of the spinal cord come all these nerves, and those nerves go and innervate every organ in your body, every single muscle, everything in your body. That's how you are able to register when something happens to you. So, I don't know, if you stab yourself in the leg by accident, Chris, you've done that before, right?
I have done that.
It's a classic thing in the industry. Well, what happens is that your nerves feel that, and it tells your brain, oh my gosh, I've done something, I need to react to it. So where we're going with this is that your brain is usually or not usually, it is the power station, if we want to look at it like that. Your nerve or your spinal cord and your nerves are the power lines, and your organs and your muscles are the homes. And if we think about it, if I drove a truck right into the power line right outside there, that can disrupt how that power line is working. So if we did that, usually what's going to happen to the home is we're going to have flickering lights of electricity, or the electricity will just turn off in general. And that's what happens with a lot of people, is that they, through poor lifting techniques, or through an incident that happens at work, or something that happens that does something to the spine, even muscle spasms, pulling that malalignment or something to it, creates an interference with how that nervous system is working. So now the brain isn't able to talk to that muscle correctly, and that's where we get a muscle spasm can possibly happen from, or some type of interference. So that's really good importance, and a good way of thinking about how that works. And the goal of what happen, of good, correct, especially back and spine health, is making sure that that power line outside is working properly. So that way the nerve conduction is working good between, house or organ and brain or power station.
Gotcha. Wow. Okay. That's a great analogy, and I never thought of it like that. So, one question that came to mind too is do you often see patients after something has happened to injure them, or is this something people should be proactive, like come on a regular basis to prevent injury?
Absolutely. I mean, so two ways of looking at that. We definitely see a lot of patients come in from injury. You know what I mean? Where they have a bulge disc, which we may go into a little bit. Herniation, strain, any type of in Tennessee, we're able to treat any part of the joints of the body. So rolled ankles, or any type of injury like that, we do treat that. But yes, as for wellness visits are important. Preventative maintenance is important. If you do not change the oil in your car as preventative maintenance, what happens to the vehicle? It is an important aspect of how the body should move and should be fixed. We also talk a lot too. I mean, you think about, like, you go to the dentist, maybe once a year or 1 to 2 times a year. It's preventative maintenance to make sure you don't have cavities, to make sure you don't have some type of degenerative changes causing an effect through your health in the mouth. And when we think about the spine, well, you can't just smile and see the spine there. and that's where people forget about it sometimes, is that they go, oh, I didn't even think about that until it's too late, where they've done damage over some time to the spine or the disc. And then that one day they pick up that wrong thing just the right way and herniate the spine, and out to surgery we go.
Yeah. Wow. Yeah. It just happens quick, doesn't it? Yeah.
Oh,
And you
yeah.
bring up a good point. Unfortunately, as you're aware, our industry has been out of work for a year, but, we're starting to see some glimmers of hope that we'll be able to get back to doing what we love here, in months or, maybe early next year, whenever that may be. Anyhow, can you kind of remind us of some of the basic principles we need to remember as we go back to our daily grind of the lifting and moving and everything we're doing on a show site?
Absolutely. Well, and I know a lot of these people have been in this industry for quite a long time, and they are learning from. I don't want to call them let's call them the seniors, even though they may not be that old. But how to correctly lift and stuff like that. They're watching and learning by that. So I don't want to focus too much on how to lift, But I think it's super important for people to see, and this is what we teach in our clinic every day, is to understand the mechanics of lifting. If you understand why it's important to do it the way I should be doing it, then you will usually correct it. Yeah, cool if I just kind of show a little demo here, kind of about how that
Yeah,
works.
go for it. Yeah,
So, all right, we got the spine here. I don't know if y'all can see this or not. All right, so let's turn it this way. Now, when we look at the spine, this is the front, where your organs and all sit in, and this green part's the low back. This is where a lot of people in the industry will usually cause damage to it. If we look in between, we have these little things called discs that sit between these vertebrae. These are little shock absorbers between the bones. And that's exactly what they do. They're the shock absorbers. They are the support between one bone to another bone, the cushion. But what it also provides is this little tiny, let's see where that there is. There we go. What that provides is this little spot for the nerve right here to come out, where again, we were talking about earlier, those nerves control the musculature and everything else and how your body works. Sensations, vibrations, cold and heat, everything comes through this to go to the brain and tell you what it's doing. But when we look at these, you see this little disc in between here. These discs are kind of like little jelly donuts. You have jelly in the middle, and you have all this hard tissue called annular fibers around it. And what that does is it helps protect the jelly in the middle so you can get this nice, good, easy bend to how those vertebrae work. So what happens if we look at the spine, when you bend down improperly, so people that will lift, I don't know if you can see here, but will lift by bending like this instead of like this, right? So when you bend forward like that, these discs, you're putting pressure on the front of the disc here and bending forward. Now, if that was a water balloon and I put pressure on the front of the water, where's that water going to end up going? Backwards. Yeah. That's where the cord and the nerves are. So what happens is when people bend improperly, by bending forward like that, what happens is they're putting so much pressure on the front of the disc, and it pushes that disc backwards sometimes, and sometimes will tap right onto that nerve right there. And what will happen is the body will go into spasm, and that's when you're hearing people go, oh my gosh, that's when I went on the ground and I wasn't able to get up. So maybe they didn't do a herniation, maybe they didn't do much more than that, but they created pressure right against that nerve for that split second, and then all those muscles that go right down here spasm up as tight as possible, because now he or she will not lift anymore or do any more damage. It is the body's fail-safe mechanism to protect itself. The disc is weakest. If we look at that disc, I kind of brought like a fake, this is actually a seat cushion, but it works really good. So if we look at that, you got the jelly in the middle and all the fibers around it like that, right? And what happens with people is that they bend wrong for so long, and that jelly starts to work itself. Okay, one day they bent wrong and it went through just a little bit. The person doesn't register anything's ever happened to them. And then what happens, they bend something wrong and a little more jelly went through a little bit again. So now we got this tear going through here, and they have no idea about it because the nerves are on the outside of the disc right here. Until that one day they bend the right way and it just taps right in that area, or it bulges, like puts pressure down here and pushes back into that area here, and that's when the body seizes up. So correct lifting is so important. It's not about just, hey, make sure you don't, just bend at the back. It's making sure, yes, you do bend at the knees, have a nice good arch to your back, so to correctly lift. But it's important to know the mechanisms and why people get injured from that.
Wow. I got to tell you, Kevin, I've been in the industry 30 years and I've always heard, and somebody showed me physically the proper way to lift, but I've never seen an example like you just showed of why it's important with the spine. I had no idea of all that was going on in there. Thank you for I've never
Yeah.
seen it demonstrated like that.
Well, and one more good point, if I can give on that as well, is that the disc is weakest at the posterior lateral part. So that means the back side part. So we're talking about way back here. That's where the disc is the weakest in the lumbar spine. That's where it has the thinnest amount of tissue. So the biggest injury that can happen, because sometimes you're just getting in spots, and I know with talking with a lot of people that come in on these shows and gigs, is that they get in tight spots where they have to not be able to bend correctly. But because the disc is weakest on that back outside part, if we think about how the mechanics of that work, that means bending forward with a twist is the worst thing that you can ever do for your low back, and that is how most people get injured. They're bending down like this, they're stuck somewhere, they're twisting and trying to pull up on it. That disc pushes back on the other side and causes that spasm to happen.
Wow. I'd never heard that either. That's the first time I'd even thought about that, but that makes sense to me as to why that would be a vulnerable spot. So
Yeah.
interesting. And you're right. That is on a show as we're touring, we do so much lifting and pulling and pushing and bending. And that's a quick way to be put out of commission for the day or for the week or for the tour, in some cases.
Exactly. So. Or do it long enough to where you get surgery and now you've really affected your career. Yep.
Yeah. Now you got big. Yeah. That's a great point. At TCW, one of the things we're big proponents of is making sure we're all mentally healthy on the road as well, because it is a stressful industry. We're gone for long periods of time. Our days are long. We're not always eating right. So mental health is important to us as well. Is there a correlation between, your practice and good back health and how we feel mentally?
Absolutely. I mean, I think everything goes to the point of movement. If you do not move and you do not keep your body moving, that's when you can begin to have some other, mental aspects of that. And then again, this is just one component. There's so many other things that can happen, to a person, obviously, to affect that. But movement is the best thing to always for anyone to be doing. So if we're thinking even right now, we have a lot of people in the industry that have either, all right, I'm sitting and I'm not sitting, I don't want to say that, but I'm waiting to see how the industry recovers, and they're not doing much. They're sitting at home. I got some patients just gaming or doing whatever they're doing just to hope that stuff just starts coming back. And it's totally understandable. And that's one way of looking at it. The other way, but the problem with that is that your body's not moving. And if your body doesn't move and you're having the outside stressors, you're also receiving stressors from the inside of the body. So we're getting a lot more cortisol surge, which is our stress hormone that occurs, which affects the body in so many ways with weight gain and adrenal failure, not failure, sorry, adrenal fatigue. Depression can go along with that as well. All these things that can occur. Movement is key, and that's what I always tell people. And when it comes to body movement, we're talking about, even just getting out and just walking outside to 15, 20 minutes a day, even if you are, just doing your thing, waiting for things to come back to where they're going to here. That is so important to do, because that changes the mind and the chemicals within the body so well to get a person to feel better overall.
Wow. That's a great point. And that totally makes sense to me too. So, again, we're hopeful our industry will be back here in the coming months, and that we can all get back to and putting some of these lessons into practice as well. But anything else you'd like to share with us today?
Well, I think just maybe a little bit more on that mobility aspect, and then I think we covered it. When I talk about mobility of the spine, and that's what we do. As a chiropractor, we are there looking for segmental misalignment, muscle dysfunction, muscle imbalances, posture imbalances. These are things that we treat to make sure the musculoskeletal system's working the way it should, to make sure the nervous system's working well. What happens when you're not getting mobility to the spine the way it should, is I want to compare it to like if you just had a tractor sitting out in the rain and you got these bolts on it, right? And you just leave it out there just for years and years and years and years. Never touch those bolts. They become rusted, to the area, and that's what we sometimes will call arthritic changes. And that does happen with people within this industry a lot too, is because you're very hard on the body and in the bus and all that kind of stuff, all the travels and all that. It's a wear and tear thing, but mobility is so important. Even if you have a little bit of that happening, or you already have back pain, it's been chronic. Getting mobility is the most important part. And what I mean by that is, imagine if you went out to that tractor that had that rusty bolt, you put a wrench on it, and you really tried to move that thing. It's going to be the son of a gun the very first time that you do it. But when you get it moving the first time, and if you went out there the next week and you got more movement to it, and you went out there the next week and you took that wrench and put it on there again, even though there's rust on that bolt, it's going to move so much easier because you've done yourself a service of getting mobility to it. That's how the spine works. That's how joints work. We want mobility most of the time on that.
Okay, that's great. Yeah, it makes total sense. And again, another great analogy to look at it like that. So, Kevin, how can some of our touring colleagues, especially those in Middle Tennessee, find you? Do you have a website we can send people to?
Absolutely, yeah. So our clinic's name is Bradshaw Chiropractic, and it's located at 4331 Old Hickory Boulevard, Old Hickory, Tennessee. And again, that's only about 20 minutes east of Nashville. We're like in the Hermitage and Madison area, just kind of at Mount Juliet, all kind of that area there. Website is bradshawchiropractic.com, and our Instagram handle, which is we give a lot of a lot of tips and advice, and correct pillows to use and how to keep mobility and good stretches and all that stuff, is under the handle of Bradshaw_chiropractic.
Oh, that's great. I'm gonna follow you and check that out, because I too, as you've said things today, my body's reminding me, especially of sitting around for the past year, and at my age, I'm going, oh yeah, we probably need to pay a little more attention here. So man, Kevin, I know you're super busy. Thank you so much for joining us today. This is great information.
No problem, man. I was so excited about it when Mark Steinwalks was talking to me a bit, and I was like, let's do this, man.
Yeah, Mark's great. He's one of our board members and huge supporter of what we're doing. And when he recommended that you come speak with us, I was like, it was a no-brainer. Like, let's do it. So again, Kevin, thank you so much. We appreciate it. And we look forward to, I look forward to making an appointment and getting there and getting you check out what I might have done in the past 30 years back here. But no, thank you so much.
All right, man. Well, I appreciate you guys. Thank you so much.
Absolutely. Thank you all so much for joining us today. We really hope you enjoyed today's topic. If you enjoyed hearing this and want to hear more of what we've got going on in the Touring Career Workshop, Human Resource Land, be sure to hit that subscribe button for updates on our latest content and videos. We enjoy putting content out very regularly, and we have a bunch of videos already in our archive, so be sure to check those out. And if you want certain topics, to learn about certain topics or hear about certain things, put it in the comment section below. We'll keep putting stuff out as long as we can. But again, hit that subscribe button and we'll get more content out to you soon. Thank you again for joining us.